And so I've talked to a lot of programs, and there is absolutely this dedication to low barrier services
Hmm.
and voluntary services. And then when substance use comes into play, that can feel especially
Yeah.
challenging. So, what are some ways that this can look like when there's substance use in the mix?
So what's interesting about, I think that there was always substance use in the mix. And I think that what we have to think about is, and I think back of like, oh, in 95 when I started, it did seem like it was fewer, it wasn't as many people that we would necessarily have in shelter that seemed to be struggling with substances as much or seemed to be having mental health issues and challenges as much as what there are now. I think there's a couple of things that come into play. There's probably more, but a couple that come to mind really quickly. Number one is over the last 25, 30 years, we have seen just this dismantling of resources for substance use and mental health at the community level. The resources just aren't there. So you've got that happening. The other piece of it is, I think we just were screening people out. And so we were asking questions that actually just, it was like, oh, they're using, we can't have them. And so what we did inadvertently, I don't believe anybody does this to mean harm to anybody. I believe people come at all of this work with good intentions and want to do the best that they can and do no harm. I truly believe that. Sometimes I think sometimes we do harm though, inadvertently. And one of those is by screening people out. And you cannot expect that because somebody comes through the threshold that they no longer have a substance use issue or no longer have mental health needs. I mean, you can't expect that. We also know that people who have experienced trauma and crisis, struggling with substance use or struggling with mental health challenges are pretty common. We also know that substance use is a really good way for an abusive partner to try and maintain control in that relationship. So if I can keep somebody using, doesn't that work to my advantage kind of thing if I'm an abusive partner? So if we screen out the folks that might be struggling with substances or have mental health challenges, we're really missing a high percentage probably of survivors of domestic and sexual violence. Our programs, our missions are to provide the services to folks. So if we are immediately like screening some of these folks out, where do they get support? What do they do? Now, I don't expect a domestic violence shelter to be a treatment center. I don't expect that at all. However, I will say that I do think that what I'm finding, at least in Missouri, is, and some of it I think is because of this project, is that more programs have been hiring counselors who also have experience with substance use counseling. I know that the program that I did work at Rosebrook Center in Kansas City, I know that they have support groups right there for residents and non-residents who are survivors of domestic violence, but are also struggling with substances. So it doesn't, I think there used to also be kind of this, well, you're going to have to be sober before we can help you with domestic violence stuff. And I don't think it works that way. I mean, they can coexist and you can be working on both at the same time. I think the challenge for programs sometimes is, what tools do we give to advocates so that they feel confident that if somebody is struggling with substances or somebody is maybe even having a mental health crisis, that they feel confident enough to be able to work with that person. And what's interesting is you do not have to be a clinical licensed anything to be able to work with another person who is struggling. Crisis intervention is crisis intervention is crisis intervention. Doesn't really matter what the crisis is. The skills you have to help in that crisis are the same. If somebody is having a mental health crisis, there are tools and skills as far as like grounding things, that you can try and help with. You don't have to be that licensed person kind of thing. We're not talking about therapy when you're working necessarily in crisis. Therapy is something different. But I think that sometimes, I understand it. I truly understand that nobody wants to feel like, oh my gosh, but what if I do something wrong? I really wish I could take that from everybody and just take that off your plate right now, because I think almost doing nothing, to me, I don't want to say it's wrong, but doing nothing isn't going to help either. So I don't mean that to sound rude or blunt, but it's like, no, you can be support. You can be support. That's something I know every advocate out there can do, is you can be a supportive person. The other thing, if we create environments in which people feel like, oh my gosh, if I use, I'm going to lose my safe place to stay. I may be creating an environment then that somebody who doesn't want to talk to me about possibly struggling with substances, where I may be closing some opportunities for conversation and maybe to be able to actually give somebody resources. The other thing I want folks to remember is that just because somebody is using substances does not necessarily mean they need treatment. And I think sometimes we get that in our heads too, that obviously if somebody is 21 or older, it's absolutely legal for them to drink. Would I prefer that they not come back to shelter intoxicated? Absolutely. Is somebody going to do it? Absolutely. I mean, it's going to happen, right? It's going to happen. Now, if somebody comes back impaired, what is the safer thing to do? I think you want to ask yourself, and then what happens? Mm-hmm. So somebody comes back impaired. I don't care what the impairment is, they come back impaired. Something's not quite right. Now, are they acting a fool and become legitimately dangerous and violent? Or have they come back impaired? You can tell it's no, this is not quite right, but there's no medical emergency. They're not a true legitimate danger, but you're not going to have a realistic conversation with them. So can you make sure, do they need something to eat? Can I get you some water? And how about I help you back to your room? Or do you have even another spot for them that they can maybe go and sleep it off a little bit? Mm-hmm. Let's talk about it when they're not impaired. Because the other thing that I have found is that if they're not a legitimate danger, it's not a medical emergency, and we can let them sleep it off. To me, that's a safer thing than saying, you have to leave, and you have to leave right now. So then I have put somebody on the street who is impaired, and I'm thinking that's probably not a very safe thing either. And if it's a medical emergency, please call 911. You don't have to take care of a medical emergency. That's why there are medical personnel, right? If this is somebody who is now, it's a legitimate danger, you don't necessarily have to take care of that. That is a 911 call if somebody is truly a legitimate danger kind of. So I think that sometimes we're trying to take on things that we actually don't need to in those moments. And I think sometimes sometimes people can become uncomfortable, and that can be mixed up with, oh my gosh, I'm now afraid and I'm in danger. And I want to make sure, I mean, if somebody, it's got to be legitimate danger. The other thing with folks, whether you're impaired, whether somebody is impaired or not, we deal with people who get angry. And so I know this isn't specific necessarily to substance use, but I do want to throw it out because I think it plays into our low barrier rules and voluntary services, but how do we respond when somebody in shelter gets angry? First of all, when somebody gets angry, it might be the first time that they've felt they can express that angry and know that somebody will not physically assault them. So if you've created a space where somebody actually does feel that they can be angry, I'm kind of like, good on you. Excellent. You've created a space where people can actually engage then. You don't need to rise with the anger, and it's okay to say to somebody, you know, you're angry. I get it. You know what? Can we maybe move this into another room that we can talk? Or can I talk to you later? You know, or if it's escalating, it's okay to tell somebody, you know what? I really want to talk with you. I'm having trouble though, being able, you're so angry right now, and I want to respect that. And I'm having trouble though, being able to have the conversation. Do you want to take some time? You know, another thing that I think falls along in those lines too, please, if somebody is angry and says, I just can't do this with you right now, and turns around and walks down the hall, please don't follow them and be like, no, don't do that. Let them go, let them be angry. I realize there could be situations where you have to intervene in some things. I will tell you, once I was reasonably sure, the one and only time that I thought, oh, this might be the time I actually get punched in the face trying to break something up. There were two residents and they were just getting closer and louder and louder. And I was like, oh, no. So I got to stop this because I don't want to have to ask anybody to leave. I don't know. No, this doesn't have to happen. So it's also one of the few times that I would raise my voice so I could get above theirs and kind of break it up. And it was happening kind of in the middle of everything. And so I wanted to move them out because not everybody needed to be in there. And so I moved them into an area in which, yes, I had exits. I wasn't blocked in, so I'm watching myself. But I got it to where they finally were talking over each other, but it wasn't in the middle of everything. And then I'd let that go for a second, be like, wait, I can't hear either one of you. I really, and trying to do that, right? Mediate that. This was coming to a fist fight, seriously, over the premiere of a TV show that night. One of the residents wanted to watch the premiere. The other one was already watching something and didn't want to give up the TV. But had I not taken the time to de-escalate that situation and mediate that a little bit, potentially what I could have had was a situation in which it could have gotten physical, but it also could have been a situation where two people could have been asked to leave for what I would say really was no good reason, because we hadn't taken the time to de-escalate that. So I give that as an example of sometimes people are about ready to get into a fist fight because of a television show. And we need to think about that it's, yeah.
And the piece that you brought up around the safety to express anger, the safety to feel anger, and how within our society and within abusive relationships, who gets to feel disgruntled, who gets to feel angry, who gets to express any of that, right? There's so much power, so many power dynamics there. And
there is also often people expressing anger. Anger sometimes comes out because somebody's afraid. So it's not, and I think that sometimes a lot of those feelings just get very jumbled up into how it comes out. And we absolutely know people who have experienced trauma often struggle with the expression of emotions in specific ways. They often have trouble connecting with people and that relationship building and maintaining, that can be a struggle for somebody who's experienced trauma. And so, when we're looking at all of those communal living issues, it just makes sense there's going to be conflict, and that's normal. and that we need to, like you talk about, the safe space, we need to be able to provide that safe space that people can express those things, but that as advocates, we're comfortable. We're comfortable with being in uncomfortable situations. Yeah.
Yeah, I often think whenever trauma is in the room with us, we need to be prepared to notice anger and to help facilitate healthy expressions of anger, healthy, but expressions in ways that aren't going to lead to a negative outcome for somebody.
Yeah.
And I love how you put that, right? Like these folks could have been exited for frankly no good reason. And how, the presence of someone who is understanding, someone who can kind of notice what's going on and then show up with folks.
Yeah.
Right?
Yeah.